covered this slide, just the sort of welcome slide and etiquette first, just to let you know, like when to avoid background noise if you're not talking, if you could just mute your microphone. And it's up to you whether you have your camera on or off. It's whatever you feel most comfortable with. And you can use the hands up function at the top, or the chat to add to any messages. Yes, okay, right, I'll stop sharing my screen and we can start. Okay, and just to let you know, this meeting is being recorded, so that people can catch up on it if they've missed it. Okay, so welcome to our session, which is the using service users in research, and what the challenges and barriers to that have been, and how other services maybe can use that to improve service development. So we're going to share our experiences in a research project that we're currently doing, and to consider like learning from this experience, and have a little bit of kind of interactive time at the end to like kind of discuss how this could be like transferred elsewhere. One of the things that we were particularly interested in was like the amount of like the barriers that we had, and that actually like overcoming them wasn't that easy, but it has like it's brought positives to the project by doing that. Cool. So we will be asking you like later on to think about and share any challenges and barriers that you might have come across, but also like the positives of involving service users in the interactive part of the session later on. So if you have any like ideas, don't feel free to jot them down during the session, and we'll just have a quick round of introductions. So I'm Ellie Warbaugh. I'm patient ambassador in medical education and research, and I'm also a service user in the trust. Jane?
Yeah, so hi everybody, my name's Jane McEwen. I'm a mental health nurse. At the moment in the NHS, I'm funded in a role 2 days a week, funded by the National Institute for Health Research, and it's in a senior nurse research lead role, and the whole aim of that's to try and get nurses more engaged in research. But the other thing to say is the NIH, or National Institute for Health Research, are really keen on service user involvement, so that forms my role as well. So nice cool. For everyone to arrive. Eilish has got a hand up.
Yes, I noticed that.
Did you want to say something, Eilish?
No, maybe not.
Sorry, no, the same thing was just saying hi. Apologies that I'm late.
Oh, okay. No worries. We're also taking this presentation, part of this presentation is Emily, who is one of the service user interviews who's involved in the project. Unfortunately, she just messaged me to say she's having a bit of internet trouble, so we've decided to start, and we'll introduce her properly when she joins us. I think I know everybody in here, but I'm not sure that everybody else knows everyone. So could we just have just a quick introduction who everyone is, so we're all aware. I will go down the list as it comes up on mine. Eilish.
Hi, my name's Eilish Manzoni. I'm an improvement facilitator with the quality team. Sorry, I'm brushing. I've just come in from the school run since I've got my coat on.
Thank you for joining us. Colleen.
Hi, I'm Colleen, service user and volunteer.
Welcome, Colleen. Thanks for calling in.
Yeah, it's great to see a couple of service users here. Gerke.
Hello, everybody. I'm Gerke Lange, and I'm a clinical leadership fellow working with the quality improvement team.
James.
Hi, I'm James. I'm a service user. I'm interested in service user involvement in the trust, so really interested to see what's been happening in the area of research interviews.
Cool, thank you for joining us. Jo.
Hi, yeah, I'm Jo. I'm Continuous Improvement Manager and work quite closely with the Engagement Experience team as well. So,
Michelle.
Hi everybody, sorry I can't put my camera on because I'll lose connectivity, has been happening today. So I'm Michelle Horspool, I'm the Deputy Director for Research. I'm really kind of keen on making sure that we do have service user engagement in research throughout the whole of the process. So this is great, and thanks Ellie.
No worries. And Emily's managed to join us. We're just
and Emily when she gets here, yeah.
Yeah, we're just doing some introductions, so we'll finish them and then we'll introduce you, Emily. Nick.
Could Nick be on mute, possibly?
Potentially. Nick, are you there? This happened to Lee earlier. He just like didn't make any sound for a while. We'll come back to him. And Emily, thank you for joining us. I know you've had a bit of an internet nightmare. Would you like to introduce who you are and what your kind of involvement with this project is?
Yeah, sure. I don't really know what to say. Hi, I'm Emily Hillison. I'm a service user and got a sort of bit of a background in research, which is why Ellie asked me to join in with this project. And I don't know what else.
That's great.
Yeah.
Thank you. Sorry for putting you on the spot. Right, thank you for that. So Jane, first of all, is going to give you a quick overview of the project that we've been doing, just so you've got a bit of background.
Yeah, so the project that we're using to as a kind of, I suppose, an example of some of the learning around service user involvement is called Carecovid, and it's a small research study that's been funded by the Burdett Fund for Nurses. So I mentioned that I was in a funded role 2 days a week, and there's 9 mental health nurses across England in that role. And in one of our meetings, we were aware from clinical colleagues that when the COVID lockdown came in and the restrictions that came with that, the way some of the community mental health teams were working had to change quite a bit. And we were interested in what the experiences of that had been for nurses, but also for service users who were receiving care that was probably quite different. So we put together a bid to go to Burdett, and at that point involved Ellie, because obviously there was going to be quite a large service user element to the study, and it seemed really important to involve Ellie in her role right at the beginning rather than as an afterthought. So as soon as we could, we involved Ellie. And the studies, it's a qualitative study. We're going to be interviewing overall 15 service users and 15 nurses working in community teams in Sheffield, in South London and Maudsley Trust, and in, I can never say it, what is it, Tuve, T's and S.
Tuve.
T's, S and Weir Valley.
Thank you.
I get the V and W mixed up all the time.
So that's just a little bit about the study.
Thank you very much, Jane. Nick just popped back in. He'd gone to answer the door. Would you be able to introduce yourself, Nick?
If I can press mute, yes, sorry. Yeah, I had to get the door because it's my son coming home from school. I'm Nick Bell and I'm the Director of Research in the Trust.
Thank you very much. Right, so we started thinking about how we were going to be doing the how we were going to be gathering the research data, and it was kind of decided that the nurses would be interviewed by research nurses or people who are qualified as nurses, and originally we kind of that was just going to how it was going to be for the nurses and the service users. But then I kind of had a maybe slightly mad idea that I was like, well, actually, if we're doing peer interviews with nurses to nurses, why not have peer interviews, service users to service users? And I put that to the team, and we discussed it because, but overall we're very receptive to it. But there was lots of, we wouldn't know where to start with this, and how do we do that? And I think this was where I sort of really appreciated being in the role that I'm in, because I was able to say, actually, I can take the reins on that. I can liaise with service users. I can navigate like how we're going to get them enrolled as volunteers or whatever. So that was how it came about. So it has affected like the way the project's been shaped, because it's not quite as straightforward maybe as using staff that are already in the NHS. They've got access to the computer systems. They've got they're used to managing service users. There's a lot more to think about. So it has influenced the way we've decided to do the project. One of the things obviously was that this is during COVID, so we're not able to do things face to face. So thinking about how we'd have service user interviewers involved and how we'd manage the technology side, that's taken some thinking. So it has influenced the shape of the project. Have you got anything to add about that, Jane?
Yeah, I think it's influenced it in quite a very positive way. I've just got some notes. I'll use the first one now. One of the other members of the research team had just reflected that it's just made things a lot easier with having Ellie involved in a position, they said, where she could be like a conduit and kind of have access people who haven't got that experience of mental health services. And I think it's been interesting as well how the team's kind of taken to the idea of service user involvement. And I think quite early on, Ellie, I checked with Ellie, and you felt that it wasn't lip service and that you were really being included. But at the same time, we were talking the other day just how we've seen some of the staff who were welcoming but had some real perhaps reservations that were just a little bit tentative about some of it was about the quality of the data. Would service users undertaking interviews get the same quality of data as if it was somebody who was experienced? And we were able to kind of challenge some of those myths. So I think we're going to talk about those a bit later, but it's just been interesting, really. I think how the teams developed, and we've all kind of learnt about one another and learnt how to best work with one another and how to be really honest with one another as well. We've had some very open and honest conversations.
Yeah, and I think that's a really key part with this sort of involvement, is actually having that sort of like transparent and open forum to be able to discuss those concerns and fears and challenges from all sides, because I think then it also it kind of it makes it less tokenistic as well if you're actually if everybody knows where everyone's standing with it. So yeah, we have had several moments where we've been like, actually, I'm really concerned about this, but we've spoken it through, and I think actually it's helped as you said, it's helped the team, the research study team, kind of grow closer together a bit, actually having those discussions, because we're all very geographically spread out as well. We haven't actually met in person for any of this, have we?
No. So one of the examples, I'm thinking, Ellie, will I use this example now where we move on to the next section? Yeah. So we've rehearsed this really well. So one of the examples was kind of a bit more recently, and I think it initially came from me working with Ellie, and like Ellie's been liaising with the service user interviewers, and it just dawned on me what would happen if Ellie was suddenly unwell and wasn't in work, and so I kind of, and it was at a time I think when Ellie was saying, I might need to take some annual leaves, and so I contacted Ellie and said, oh, why don't you put me in touch with service user interviewers just in case you're not around. But I realised at the back of my mind there was a bit of a, you know, what if Ellie goes off poorly? And then we had this conversation in the group, and it just challenged one another, you know, in the view of actually what happens if any of us go off poorly, particularly at this time. So it was one of those moments where you kind of move from maybe a bit of prejudice or judgment, and actually you kind of flatten it out and realise we're all in that position. And it was a helpful conversation because we've developed contingencies now for if any of us go off poorly. But yeah, it was just quite an interesting moment. So Ellie, I suppose what's been your experiences of being a member of the Carecovid research team?
Yeah, I think this is the first time I've been fully involved in a research project myself. So we've got service user involvement really at the core of the project, and that's been, I don't know, it's been a learning curve for me, because although I work in research, I'm kind of just seeing snippets of it here and there. So it's been, for me, in terms of my personal development, it's been really nice to see that the whole research process and all the things you have to go through. That's been really nice to see. And then also, I think it's been something that's given me quite a lot of self-confidence about what I can bring to research, because I don't come from a research background necessarily, but I do have other skills, and one of those skills is being able to kind of liaise with people, is being able to access service users, like recruit service users and support them, and I've really enjoyed the challenge, and as I said earlier, I've really enjoyed the fact that I've been able to be like, yeah, there's kind of lots of challenges there, but this is what my role's about, and I can take those and try and navigate through some of them. So I found it's really helped, yeah, my self-confidence, and it's been absolutely lovely to be part of a team where I really feel like my views coming from a service user point of view are equally as valid as anybody else in the team. That's been really nice. Sorry, I've just locked myself out of my computer. So we're going to get Emily involved a little bit more now. So what made you decide to get involved with this opportunity, Emily?
I mean, first of all, you asked me and I can't say no. But no, in seriousness. So I did a few years ago, did a research master's, and then I worked in research, doing research interviews for linguistic purposes. So I've got sort of a research background. I enjoy doing research interviews. But then sort of when my mental health kind of deteriorated and I had work, I lost the connection to that part of my life, which was actually quite a big part of my identity. So, I have to jump on this opportunity basically because it's a chance to kind of start building up to getting back into this sort of work again. I guess it's not just like about the work experience, it's also like sort of knowing how the project's kind of formed and things means that I feel safe in knowing that it's okay that I sometimes struggle. In fact, that's why I've been asked to do this. So, yeah, I don't know.
It's kind of
way to be able to get back.
Yeah, it's kind of like a friendly environment to get back into it when it's kind of okay to be a little bit vulnerable maybe in exactly. It. It's
I think that was it for me really.
I think that's really important as well, because quite often we hear people saying, oh well, you're thinking about the benefits to the service of involving the service user, and will the is this, are we taking up too much of people's time, are we asking too much of people? But actually I think people quite often forget actually the benefits to the service user of being involved.
Pretty vast for me, to be honest. Hang on, I'm just gonna look at my
sorry, hang on one second, it's me. The
Yeah.
background noise.
Question for Jane coming up now.
Okay.
I was going to ask you, what's it like to be working for you, like from your side, what's it like to be working on a project with quite such significant service user involvement?
Okay, thanks, Emily. It's great. It's great. There's lots of learning. As I say, there's a lot of, I think for me, really seeing how the team has developed and grown in confidence. I mean, Ellie's talked about her confidence, but I think for me it's been great to see, and I'll give an example. One member of the team, I think, was initially a bit concerned. I mentioned that a bit about data quality, you know, or what, and I think Emily's just given the perfect example of where she has these skills and experience in research, probably more than some of the nurse you know, interviewers that we're going to use, because we're using, we've invited nurses as a bit of a development opportunity to build their research skills. So Emily would probably kind of be far more experienced than them in interviewing, and yet we were having those kind of conversations. But that team member she's been very reflective, and she's always been very polite how she's raised her concerns, but her position's completely moved, I think, and now she's kind of contacting Ellie and you know, to invite her to take part in things, and it's just been lovely to see that more just a flattening, you know, a collaborative, we're all in it together. And I think those concerns about the data, actually it's the reverse, and I think we'll get better data. I think service users who are being interviewed are more likely to be honest and feel comfortable being interviewed by somebody who understands their experience. So yeah, it's been great for me.
Yeah,
James has got his hand up.
How many service user interviewers did you have on the project?
We've got 3. So we've got 3 nurses doing interviews, and then 3 service users involved, and then we've also got some service users involved in the reference group, so kind of advising on the project as a whole as well.
Brilliant.
Joe has put in the chat about why do people feel that those who have lived experience of mental health have no other skills, and that you've come across this quite a lot. I do agree. I think it's sort of I definitely kind of felt this originally when I started getting involved in stuff. I didn't know whether I was just being involved because I had mental health problems or whether it's because I genuinely had skills. And it is important to remember that people have got lives outside of their mental health. People have got histories and yeah, a lot of skills to bring. Joe.
Yeah, sorry, I just wondered if I could pick up on that, and I feel like this week has been a real opportunity for me to keep saying various different things around this, but I do feel really quite strongly about it. And yeah, it's just, you know, if you look at the figures, and I don't know them off the top of my head, but they, you know, the numbers of people who suffer with mental health issues, and I know our organisation goes wider than mental health as well. You know, it's the majority of people, really, and so why do we think that they haven't got other skills? I was really surprised, Jane, in what you were saying about, you know, can service users have, you know, do this, and it's yeah, you know, you wouldn't think it if it was someone turned up with a broken leg. You wouldn't go, oh, can you no longer, you know, how can you do this with an analysis? You wouldn't really think about it. You know, I find it fascinating, for want of a better word. I don't know what other word to use, but fascinating. But I think it's definitely something we're talking about, our culture as an organisation, and I think it's definitely something that, you know, we need to recognise. Absolutely, we need lived experience of service users, but as human beings, not just because they've got a condition. I hope I'm not speaking out of turn saying that, but I just think, you know, everybody brings experience of different things, don't they? And brilliant that you bring a range, you know, Emily, of experience, the research as well, and some, you know, you've got a whole vast amount of knowledge and experience and skills that you can bring, and that's fantastic. You know, so yeah. Sorry, I feel quite passionate about this.
We like it.
Yeah, I agree, but I suppose it's better that we know that those kind of views and opinions exist, because that's when you can appreciate that and start to challenge them, isn't it? And I guess it's by people being involved that challenges that, and that shouldn't have to happen. But I
think
sorry, Ellie.
Yeah, I was just thinking, because you said earlier about realizing you had some prejudice that you hadn't maybe acknowledged before, and like even myself, coming from like a service user background, I think when we had the discussion about the illness, I think, to be fair, I'd only actually thought, oh, what happens if the service users are ill or unable to do it? But actually, when we had that conversation, we realised actually we needed to make a wider sort of protocol for that, because of the situation that we're in at the moment, where any of us could be ill. So I realised that I myself even had that prejudice to some extent. Like I think we as service users can often see ourselves in a prejudice light almost as well.
Yeah.
Yeah, I just want to come back on that as well. Absolutely. And that wasn't meant to be any. I hope that didn't come across wrong. And,
no, it didn't at all.
And picking up on that, I think you're right in terms of, sometimes we have service user representation who feel that if we haven't got somebody who says they're a service user, so absolutely that kind of on the other side, isn't there, in terms of actually there's staff who've got that experience as well. There's people with lived experience who've got other skills. So absolutely on both sides, I think I meant that in my kind of a more of a generic, that everybody has their role. So yeah, sorry, I didn't mean to, if that came across wrong. I
don't think it came across.
Lots of skills.
Yeah, I don't think it came across. Well, I don't know. I
don't think it came across wrong.
I think the honesty that we've had in the team has allowed these conversations to happen, I guess.
Which is fantastic. So.
Yeah.
Do we want to move on, Ellie? Do you think to people's? What were we going to?
Yeah, we're going to talk a little bit about the kind of like challenges and the benefits of being involved, and then kind of ask people to reflect on their experiences of, which we've already kind of started doing, I guess. Like Joe's just said, like, it's something that's been challenging in her thinking about, like people feeling that people don't have skills and things like that. So yeah, I think we're just going to talk a little bit about the challenges and benefits that we've come across, and then we'll move on into a bit more interactive stuff. I think one of the things, and I know we were speaking about this last night, Emily, weren't we, about the difficulty of, there is a lot of things in research now saying, like, we want to get service users involved, service user researchers, but actually when it comes down to the nitty gritty of it, the research landscape is not set up to let people be involved if they're not already a professional. So we had really big issues with getting people involved on the good clinical practice training, didn't we, Emily?
Nice. Yeah, it turns out if you don't have an NHS account, you can't access the training. So can't remember what we did, but
it was. I think you could have an NHS account, you could have like a university account, those sort of type, very kind of like, for want of a better word, like elitist options of an email address to be able to do the training that you need to be involved in research. And it was quite complicated, and it involved a lot of phone calls from me to the NIHR, and I had to oversee everyone with my NHS email address. And I was speaking to the brain injuries group. They'd got a head injuries in homelessness research group, and they really struggled with that, especially as it's something that their service users kind of struggle with, like forms and things like that, and they had to I think one of the staff members had to take it all on for them, and they were like, if she wasn't able to do that, we wouldn't have been able to be involved at all. So I think the feedback that I'm getting is actually research, the way like the NIHR, the National Institute for Health Research and stuff, is set up isn't particularly friendly to people coming from outside of healthcare or academia.
And I think if we kind of move that to kind of more a service development of aspect, just some of the systems we use. Although I'm going to give a research example, we had a Carecovid meeting this morning, and we were discussing the training that we're going to be offering to all the interviewers, people that are going to interview within the study, and we were just saying Zoom is actually the most accessible for most people, and one of the team was really struggling with Zoom, saying, "Oh, we're told we have to use Microsoft Teams," and sometimes it is just the little infrastructure things that are, as you say, geared up to potentially exclude people without meaning to. So I guess that's just sort of learning and thinking, moving it to a service development or QI point of view.
Yeah, definitely. So should we move on to like kind of sharing some sort of, like, I don't know if any of you have had chance to think about this while we've been talking, but like in the things that you're involved in, or the service that if the services that you're involved in, or the service development that you're involved in, or if you're a service user, have you come across challenges and barriers in this sort of thing, and has it been something that's put you off, or has it been something that you've overcome? Like, has anyone got any experiences they can share with us?
And if people don't want to talk, they can use the chat function.
Yeah, feel free to put in the chat and we can.
Yeah, or any real benefits of having been involved from either side, you know, from being involved or being a team that's invited involvement.
Down, putting my hand down so I won't forget to take it down after I've spoken. So I guess, you know, from the kind of QI work, with regards to challenges, you know, when we do support microsystems, you know, for staff, that I think everybody, of course, is there to, you know, do the best job for service users, but there is hesitation of that involvement right from the beginning. And I think it's just a culture where we are not used to it. And I don't think it's not for want of not wanting it, but there's just something where kind of, you know, it just feels, is it uncomfortable? Is it the unknown, you know? And actually my experience when you then work through this and also really think carefully about what is possible, what is appropriate, and that of course is very much also for service users. When you then can overcome barriers and find a way that, you know, we can hear service users. For example, one thing we did interviews with service users and families and carers and recorded them and then shared it with the team. And the shift, you know, it's just immense, you know. And so with regards to you asking about the benefits for, you know, of that involvement, is massive. And I guess the other thing also, I guess, which is really important, is to always closing that feedback loop, you know, so that when kind of involving service users, to ensure that then to kind of again feedback, well, what has happened as a result of you actually, you know, being part of that, or not as a result. Of course, ideally it's good when they're there, or when, you know, kind of people who we care for come together as a group, as part of the team. So yeah, but I think also just to share earlier on, you know, that sense of kind of with regards to the person, I think that's really something that is really striking for me. And I think there is something, you know, working in mental health often or cannot be seen, as not as visible. And interestingly yet, it's such, you know, where people then kind of feel maybe more like, Joe, you took the example of a broken leg, you know, where actually there's no hesitancy maybe to kind of speak and ask questions. Whereas with mental health, there is something that kind of touches a bit closer to the heart, maybe. And that also really links, again, you know, just echoing what Joe said, that we all have times in our life, you know, when we maybe struggle with things, and it maybe makes us feel a bit uncomfortable. So, and is that, you know, part of it?
Yeah, definitely. I think there's a slight, I guess, sorry to come back to the broken leg sort of analogy, but you can see if somebody is physically not okay. You can tell that. If someone's in pain, you can tell, but it's harder for people to see if somebody is mentally in pain, and I think that can sometimes cause anxiety for people, like, oh, actually, is this too much for this person? How will we know? Or all of that, and that can, again, but that's about that, having that open conversation and keeping that platform open to discuss those things and ask the questions and stuff.
Response to you, Ellie, there. I feel like that's why it's actually quite helpful to have someone like you involved in the project, because I mean, partly because I know you anyway, but then I think also like just having someone who is a service user, that the service user involved, like the service users who are involved can talk to, means that it's actually a lot more comfortable to be able to say, I'd be much more comfortable saying to Ellie, like, actually, today. Whereas I think maybe if that was just like a member of staff, that might feel a bit different. Yeah,
definitely. I can see that as well, like thinking in my own sort of experiences, it is that little bit easier to say something, and yeah, I feel like I like to be able to be that person who can reassure you, like, don't panic, that's fine, or how can we help you do this, but then I can also pass that on in a helpful way to the rest of the team.
James has got his hand up.
Have you conducted any of the research interviews yet?
No, we haven't yet. One of the things that comes with research, and sadly is probably might slow things down a bit, is the whole thing about research ethics. So partly it's to go through research ethics involves gathering lots and lots of information together and getting everything right and having it double checked and getting all sorts of approvals. So that's taken time. But also we're at the point now where we're going to the ethics committee in November. Some research will go quite quickly and be seen outside of an ethics committee. It'll be like seen by just a couple of the ethics committee, not in a main meeting. But the feedback we've had is because the research involves service user interviews, and because potentially some of the questions might be distressing, then it needs to go to a full research ethics committee. So it's all kind of held us up. And there's a lot about protecting people and making sure that researchers aren't doing, awful things to people. But we were kind of saying as well, there's a bit of paternalism, a bit of overprotectiveness possibly there as well. So that's a very long way of saying it took us a long time.
And because of the service user involvement, that's one reason why it's taking longer to go through the ethics committee.
Partly, I mean, to be fair, it would go through an ethics committee anyway, even if there wasn't service user involvement. But I guess we might have not had to go to the main committee had there not been service users. So yeah, it is.
I think one of the things we discussed this morning was like the concern with the ethics committee. You don't know that there's going to be someone who comes from a mental health background on that committee, so that can I don't know, we had concerns that people might kind of, which is, I think you said, Jane, like overprotect, like be overly concerned maybe when they don't need to. So we spoke about how there may be the potential, for example, for me to go along to that to reassure from a service point of view how we're going to deal with those things that might come up. For example, like the protocol for if we think someone might be at risk, for example.
Yeah, Joe points out that there definitely is a need. There's a balance to kind of protect people, so that the last thing that we would want to do is interview people and then be distressed and us have no backup plan. And so that's something we've been able to, you know, I feel like we've got quite a strong backup plan and rationale and support. But no, you're quite right. You know, ethics overall is to make things safe. It's not to exclude people. But it's just be interesting to see how we get on.
I think in some ways we've potentially, because of the amount of service user involvement we've got, I think we've probably considered backup plans and things like that. Maybe in more detail. It's more robust maybe than we might have done without.
Yeah. The other thing that when Emily was speaking, it made me think, I'm in a role now that really I don't suppose I've worked clinically, as it were, for a lot of years. But I do think is interesting Emily's point of view, you know, that you might feel less able to talk to somebody who's a staff member, and I can completely see that, you know, and I guess that's where some of the, I don't know, sometimes think some staff in clinical roles, I don't know how to say, they're having different relationships with people at different times, aren't they? And sometimes those relationships aren't always as positive as they can be because of the situation. I don't know what I'm saying, but I kind of think that can sometimes kind of set up barriers.
And
I
just realised that
sorry, say that again, Emily.
Pardon, say again.
I realised that I probably brought a prejudice of my own to that, in thinking that another service user would understand my concerns, whereas a staff member might not.
No, I don't think so. You know, I guess, you know, I think, no, I wasn't suggesting that, but, you know, I think,
No, I think it's useful. As I said, we've all got prejudice. I had just had this conversation before with someone before. Like, we all do have prejudices. Sorry, I can't say that word. We all have prejudice. And like, if you don't admit that you've got prejudice, then there's something going on there. And like, yeah, that is a slight prejudice, but it's also it might be slightly a fact. And at the end of the day, it's important that you have someone that you feel comfortable with, and in this circumstance, if that's somebody who is also a service user, then that's what needs to happen. What's Joe said, so people yeah, it's true. Like, again, like it's about people, isn't it? It's about humans. I think that word's been mentioned a couple of times.
But it might be about past experiences of relationships as well. With,
Yeah, definitely. I think I was getting a bit confused with time, but I think because we finish at past, don't we? So I think we need to bring it to a close. Has anyone got any last minute burning questions or comments they want to make? Girk has just said, found prejudice a very interesting topic, and how important it is to have conversation and checking out people's thoughts. Rather than, I think it's really important, just keep voicing those. Like, it's okay to have prejudices and speak about them, and I really need to learn how to pronounce that word properly.
or just differences. I don't know. It's a strong word, isn't it? Prejudice, but
Need to learn how to spell it. Cool. If anyone's got any more questions afterwards, feel free to contact any of us. Thank you all for coming along.
Thank you, Ellie, Jane, Emily.
Thank you very much. Bye-bye.
Bye.
Thank you to
there's a few comments just coming in. I'll wait and see what they are.
Great session.